Hi friends, welcome to classes by Lab Doctor. So in the previous videos, we have seen about the importance of vitamin D, causes of low vitamin D, and what are the symptoms of vitamin D deficiency. सो ये जो विटामिन डी का टेस्ट होता है हम कॉमनली करवाते हैं एंड पेशेंट्स हमेशा जब ये रिपोर्ट देखते हैं तो समटाइम्स दे आर कंफ्यूज्ड कि पहले तो कौन सा टेस्ट करवाना है एंड व्हाट टेस्ट इज करेक्ट व्हाट टेस्ट इज रॉन्ग. So let us see how does a vitamin D blood test look like and how do we understand the reports. So ये जो vitamin D test है, before that you should know vitamin D metabolism. So just let us recap. So when the ultraviolet B rays, when it falls on the skin, the cholecalciferol which is present in the skin, you also get it from the food, and this is converted into 25 hydroxy vitamin D3, and this 25 hydroxy vitamin D3 is formed in the liver, and this gets converted to 125 dihydroxy vitamin D3 or calcitriol, which is the active form in the kidney. So 125 dihydroxy vitamin D3 is the active form, whereas 25 hydroxy vitamin D3 is the stable form. So usually जो blood test हम करवाते हैं that is 25 hydroxy vitamin D3, ये ही टेस्ट करवाते रहते हैं. सो मैंने बोला देर आर डिफरेंट टाइप्स. अगर आप लैब में जाओगे तो देर विल बी वेरियस टाइप्स ऑफ विटामिन डी, लाइक यू हैव विटामिन डी 25 हाइड्रोक्सी, और you'll have vitamin D ultra sensitive, vitamin 125 dihydroxy. So remember the most common test which is done is this 25 hydroxy vitamin D, which I told you was a stable form of this vitamin. So this 25 hydroxy vitamin D is the one which we usually do in the laboratory. ये 125 dihydroxy vitamin D we do in certain cases, but most commonly ये अपना जो भी comprehensive panel, ये panel वो panel जो भी रहेगा, या usually अगर आप lab में जाके आप अपना vitamin D check करवाते हो तो that would be vitamin D 25 hydroxy vitamin D3. So this is a report here. What is the method they have done? 25 hydroxy vitamin D, the results, and the normal range. Here the units. So it can be either in nanomoles per liter or it can be in nanograms per. And I've written what are the causes for reduced vitamin D. One is the inadequate exposure to sunlight, or if you are consuming less of vitamin D in your diet, or there is any gut issues, you have inflammatory bowel disease, Crohn's disease, celiac disease, bariatric surgery, etc. Vitamin D malabsorption is taking place. There is some severe hepatocellular disease, alcoholism, cirrhosis, etc. Certain medicines like anticonvulsants, antacids, they can reduce vitamin D. Kidney problem, chronic kidney disease, or you have nephrotic syndrome, they can reduce the vitamin D levels. Increased level is seen in vitamin D intoxication. So now when we say this deficiency is always classified as mild, moderate and severe deficiency. Okay, so mild deficiency is when your vitamin D level is in the range of 20 to 30 nanogram per ml. Okay, 20 to 30 nanogram per ml, and if it is between 10 to 20 nanogram per ml, that is moderate deficiency, and if it is less than 10 nanogram per ml, that is severe deficiency. Yeah, this is nanogram per ml and this is nanomoles per liter. Okay, so less than 10 nanograms per ml or less than 25 nanomoles per liter, then it is called as severe deficiency. So please see ki, what is the units what they have given. Okay, so agar it is in nanograms, if it is less than 10 nanogram per ml, then you have a severe vitamin D deficiency. Or if your value is less than 25 nanomoles per liter, then you have severe deficiency. Okay, so what is the optimal range then? we expect for the normal functioning, we expect it has to be between 50 to 70. Though 30 is also considered as sufficient, but for the optimal functioning, you need a value of 50 to 70 nanogram per ml. That is the optimal the vitamin D will function. See here, you can see when when there is if it is 15 or less than 15 nanogram per ml, then there is calcium metabolism is impaired, there is impairment of skeletal mineralization, there is rickets, osteomalacia. At around 10 to 20, then you have muscular function deficiencies, balances, reflex, your walking style, your gait, your grip, that is going to change. Patients will have fall, injuries. At less than 30, osteoporosis, fracture, secondary hyperthyroidism. So for a proper functioning, you need at least a level of 50 nanogram per ml. So many of the laboratories say okay, up to 30 is okay, 30 is fine, but for the for the fine tuning and for proper ultimate functioning, at least 50 nanogram per ml should be the level of vitamin D. So sometimes the vitamin D level becomes more than 3 times. So that is more than 150 nanogram per ml. That is vitamin D toxicity. Okay, we will discuss about vitamin D toxicity in a separate video. But when the level of vitamin D is more than 150 nanogram per ml, that is called as vitamin D toxicity. So the same thing which is given here, for the optimal level, it has to be at least 50 nanogram per ml, and if it is more than 150 nanogram per ml, that is toxicity, and very severe deficiency if it is less than 10 milligram 10 nanogram per ml. So this is another report wherein the lab has given the name as vitamin D ultra sensitive. Okay, so here they have calculated the 25 hydroxy vitamin D, then there is D2 as well as 25 hydroxy vitamin D3, and they have made it as 25 hydroxy vitamin D total. Okay, so now this is another report wherein they have estimated 125 dihydroxy vitamin D or calcitriol. Okay, so now you all know that once the sun rays falls here, this pre-D3 or this from the cholecalciferol, with the help of this 25 hydroxylase enzyme, you get calcidiol, and from calcidiol this gets converted into calcitriol or the 125 dihydroxy vitamin D3. So this vitamin 125 dihydroxy vitamin D3, this is a active metabolite of vitamin D, and we do this in few conditions. We are not doing this regularly, but this is done in few conditions. That is, when we have to differentiate between a primary hyperparathyroidism and hypercalcemia of cancer. So how do we differentiate from primary hyperparathyroidism from hypercalcemia of cancer? In primary hyperparathyroidism, what happens? There is increased secretion of the PTH. So when there is increased secretion of PTH, it will lead to increased absorption of calcium, isn't it, from the intestine, decreases the excretion of calcium from the kidney, and increases the resorption of calcium from the bone. So it will increase the level of this calcium in the serum. So for this, it will need the 125 dihydroxy vitamin D3. So in primary hyperparathyroidism, there will be increased level of calcium, and also there will be increased level of this 125 dihydroxy vitamin D3. But in case of hypercalcemia of cancer, there is something hormone which related to your parathormone. It will not need this 125 dihydroxy vitamin D3. The level might be normal or it can be low. In primary hyperparathyroidism, what we see is that the 125 dihydroxy vitamin D levels are high. But what happens in this hypercalcemia of malignancy, there is this parathormone related hormone, okay, that acts like parathormone, but it functions in a different mechanism rather than this increasing the 125 dihydroxy vitamin D3. So the level of 125 dihydroxy vitamin D3 is less in hypercalcemia of malignancy. Okay, so this is how we will be able to differentiate whether it is a primary hyperparathyroidism. अगर primary hyperparathyroidism है तो your the active form should be high, and if it is because of malignancy, hypercalcemia because of malignancy, then your 125 dihydroxy vitamin D3 level should be low. This is what I was telling you. So there is parathormone, it is there is a tumor or there is hyperparathyroidism. So here you have the increased resorption from the bone, increased absorption from the kidneys, increased absorption from the gut, decreased excretion from the kidneys, and it will rise the calcium level in the plasma. Even in hypercalcemia of malignancy also the calcium level is raised, but here the 125 may not come into picture in hypercalcemia of malignancy. So now in rickets. So rickets is a condition wherein the bones are very soft. Okay, so there are different types of rickets. In vitamin D resistant rickets, okay, so what happens, the body will not respond to the active form of this vitamin D or the calcitriol. This means that even though we have 125 dihydroxy vitamin D level in the body, it might be normal or it might be elevated, the body tissues are unable to make use of this. So the level of 125 dihydroxy vitamin D might be more or elevated because it is resistant. The body is resistant to this vitamin D. Whereas in vitamin D dependent rickets, what happens? The body has trouble converting vitamin D into its active form. That is, the calcitriol is not formed. Okay, and this is actually responsible or it is needed for the calcium and bone health. So here, when there is no conversion only taking place, that time you expect that your calcitriol or the active form is less. So this 125 hydroxy vitamin D, we do it in certain cases, usually to differentiate between primary hyperparathyroidism and hypercalcemia of cancer. You have to differentiate between vitamin D dependent rickets and vitamin D resistant rickets. And in case of chronic renal failure, this active form is not formed, so the level will be low. So in that conditions, etc., or when we want to assess the compliance of this 125 dihydroxy vitamin D therapy, etc., that is the time only we do this 125 dihydroxy serum. Vitamin D is a fat soluble vitamin. It's called a sunshine vitamin because majority of it comes from the sun, and when the sun rays falls on your skin, this vitamin D is produced. You also get it from the food and dairy products, fish, etc. The active form of this vitamin D is calcitriol. Its main role is in the maintenance of this calcium metabolism. So how do we assess the vitamin D? We assess the optimal level of 25 hydroxy vitamin D, calcidiol. Okay, so that has to be at least 50 nanogram per ml. For the optimal functioning, it has to be 50 nanogram per ml. If it is less than 10 nanogram per ml, you are severely deficient in vitamin D. If the level of this vitamin D goes more than 150 nanogram per ml, that is called as vitamin D intoxication. So that was all about this vitamin D and the lab tests which are done. The prices of this also vary from lab to lab. Vitamin D might cost you anything from 900 to 1200. Vitamin D3, that will cost you little more. So these were the different types of vitamin D which we do in the lab and their report interpretation. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.